Bam! Kasich just said these two words that will stop healthcare debate in its tracks. If you are like me, you are concerned about what is going to happen with healthcare in America. I think we can all agree that the ACA or Obamacare is dying a painful death for many. People I know are getting letters saying that their coverage is going to end soon. States have either no insurers who will provide coverage or possibly only one, so that there is no real choice. But there's components of the ACA that are good, being able to keep your child or children on your plan until they are age 26, for example, or insurers not being allowed to deny coverage for pre-existing conditions, or the part that makes it so that your insurance carrier can't cut off your cancer treatment, for example, in the middle of treatment. This is all good stuff I think most of us would like to keep. We are in the middle of a complicated battle, and it's not just Democrats that are pushing back. Many GOP senators are as well, and they are being joined by many GOP governors as well. Governor Kasich, for example, is concerned about the Medicaid cuts in his state of Ohio. According to him, this will affect people being able to obtain opioid addiction treatment. The current bill is projected to cut $772 billion in funding for the Medicaid program over a decade. Governor Kasich, as well as governors of the state of Arkansas, Alaska, and Nevada, are becoming very vocal with the senators of their states regarding their concerns, and the bill cannot pass the Senate if more than 2 senators vote no. As it stands now, 9 senators have publicly stated that I assume, oppose the current Senate bill. This is important stuff that affects all of us. Please share and comment your thoughts. Let's take a listen to John Kasich on Trump's health care bill. Republicans need to... and they left it.
Ohio's Montgomery County claims an unhappy title as the deadly heart of the opioid crisis, with more overdoses per capita than anywhere in the country. And the sheriff's office says deaths could quadruple this year. The Buckeye State's Republican Senator Rob Portman says he's concerned the bill doesn't do enough to help opioid addicts who are getting treatment under Obamacare, which makes him a critical vote in the Senate. And the state's Republican Governor John Kasich, who shares those concerns, joins me now live from Columbus, Ohio. Governor, thank you so much for joining me. I'll just start right off the bat. Is this a good bill for the people of Ohio?
Well, there's a few aspects of it that have improved. For example, the phase out of Medicaid expansion over 6 or 7 years is an improvement. But the total number of dollars that are going to be dedicated to Medicaid are not enough. I mean, it's not enough resources there. And I've been very concerned here in my state about treating the mentally ill, the drug addicted, the chronically ill, particularly under Medicaid expansion. If you look at the entire Medicaid pie, there is huge challenges to it because the resources are just not there. And I think we'll find that over a 10-year period, Medicaid funding will be significantly curtailed and not accompanied at this point with the kind of flexibility we need, particularly as it relates to the pharmaceutical companies, where we need to have greater flexibility. So we would be looking not just at affecting those who are drug addicted, but also children, seniors, the disabled. Now, on the other side, the exchange side, where I just heard the secretary talking, he said there are counties that aren't going to be served by insurance companies. Well, the problem with the bill in the Senate is it eliminates the subsidies to the insurance companies, I think, after 2 years, which creates more instability and more confusion. Nobody is saying, nobody, not my colleagues on the Democratic side, no one is saying that this doesn't need to be fixed. Of course it needs to be fixed. But you cannot do it in a way where you deprive people of the resources they need to have a stable program.
So given that...
And if on the other on the exchange side, Dana, if you don't have enough resources in there, then the kind of health insurance that people can buy is what's completely inadequate. It's not enough money. Nobody would want to live under that.
Okay, so given the problems that you just laid out, do you think that Senator Portman of Ohio should vote no?
Well, I don't think the bill's adequate now, and unless it gets fixed, I would look. I'm against it, and I'm not against it just because I want to be against it. There's some things in these bills, in these provisions that are an improvement. My job, as I see my job as a governor of a state, not as a Republican governor, but the governor of this state, my job is to look not just today, but in the out years at the impact it's going to have on people who need help. Dana, I was at a restaurant on Friday, and I was at a Wendy's actually, and there was a partition, and I looked over at the people that had gathered there, and there were about, I don't know, 25 kids. All of them were here in Columbus for Special Olympics. And I looked at them and I thought, are these people being served? Are they going to be served by this bill in the future? My conclusion right now is no. Can they improve this bill? Yeah, I think they could improve it. I hope they do.
So if there is no improvement, just to be clear, you are encouraging your senator and perhaps others. I mean, you're encouraging Republicans to vote against this unless it's improved in the ways that you just laid out.
What I'm encouraging them to do is to fix it. Now look, I just wrote a letter with a bunch of Democrat governors and Republican governors, okay? And what we're saying is, let's work together on this. Let's not rush something through. Let's have transparency. Let's have some cooperation between the parties, because if you don't, this bill's not sustainable. So I'm not saying just kill the bill. Let's get something that's going to work, that's going to create a stabilizing all these issues around insurance and coverage, and then get to the heart of the matter, which is the rising cost of health care, frankly, which this bill doesn't begin to even do.
Governor, the Trump-Pence super PAC announced that it is going to run ads against Senator Dean Heller, who is one of the most vulnerable Republicans up for re-election next year, because he spoke out against the bill, not unlike you are right now. Let's listen to that ad.
Senator Heller has made his opposition clear. That is unacceptable to us and the millions of Americans suffering under Obamacare. Heller is now standing with Pelosi. Unacceptable. If you're opposed to this bill, we are opposed to you.
Is it smart for a Republican group to target a fellow Republican like that?
Dana, this is the 21st century. This is the craziest time I've ever seen in politics. And maybe this is a signal that instead of people just confessing their loyalty to one party or the other, maybe they ought to be confessing their loyalty to the country. And look, I've been attacked all of my career. And the fact is that you got to stand on your own 2 feet, explain how you feel about things, and be a leader. I don't think we have enough leadership. I think there are too many people that cower, in the wings because of partisanship. Not just Republicans, Democrats as well. If you try to get a great number of governors, Republican or Democrat, to speak out on this, where are they? All you hear are crickets and chirping, because they're worried about upsetting their base.
Or getting ads run against them like that.
Pardon?
Or having ads.
So what? Then if you can't take a fastball on the inside, get out of politics. If you can't take a pitch thrown at you, you can't get out of the batter's box, quit. Don't whine, and I don't think Senator Heller is whining. But I also want to say that not only Heller, but Sandoval. Brian Sandoval is a great governor. His popularity is sky high in Nevada. And you know what he's saying? I'm worried about poor people. You know what? Both parties ought to be worried about poor people, because I don't think either party particularly cares about helping poor people. You look at the rates of poverty, you look at the problems in this country. We have not designed a system to get people work. Everything we're talking about now, getting people healthy, giving them health care, is designed to get them to work. It's designed to give them an opportunity to have a better life. This is not some kind of a welfare system. This is a look, if you're sick and you're hungry, you don't work. If you're healthy and you're fed, Governor, you can get a job. And we expect people to have one then.
Governor, before we go, I have to ask you, did run for president against now President Trump. You are proud of the fact that you never endorsed him. He took a victory lap this week after winning a 4th special election contest. At least Republicans did. Listen to what he said.
They have phony witch hunts going against me. They have everything going. And you know what? All we do is win, win, win. We won last night.
Does he have a point that never Trumpers, and you probably are still one of them, can't beat him?
Well, first of all, I'm not a never Trumper. I'm for the President of the United States. It's just when he's right, I'm going to praise him like I did when he said he wasn't going to kick the Dreamers out of the country, but I'm also going to criticize him when he does things that I don't happen to agree with, including on the House health bill, which he then turned and called mean, which I give him credit for. You know, at the end of it all, 2018 is going to be a race about did the Democrats have a message, which they seem not to have one, and can Republicans hold on? I don't know where this is going to go. I know the races that have been held so far have been held in predominantly Republican districts. Republicans have won. Good for Republicans. At the end of the day, though, 18's a long way away, and we'll just have to wait and see what happens.
Governor John Kasich.
It'll be interesting. You guys are going to get great ratings because of all the coverage you're going to give to these races. It's going to be exciting.
Well, it is going to be exciting, but more importantly, it's going to be consequential for Americans. Thank you so much, Governor. Appreciate it. Appreciate it.
Thank you.
Well, let us know what you think in the comments below.
In the